Alright, so now we're going to learn rigid taping for shoulder joint. And when we speak about shoulder joint, the rigid taping is meant to stabilize the acromioclavicular joint. Alright, so let's look at the skeletal anatomy of the shoulder first. So in the shoulder joint, we have the humerus as the distal part of the shoulder joint. Then we have the clavicle coming here, and if you see on the top, that's the scapula, and that is the clavicle and the acromion. That's the acromioclavicular joint that we are going to stabilize eventually. Then we move around to look at the lateral aspect. That is how the shoulder joint looks like. So you have the acromion process of the scapula coming from the top. You have the suprascapular notch. You have the acromion articulating with the clavicle, forming the acromioclavicular joint. Alright, and now if we look at the muscular system or the muscular part of the shoulder joint, it tends to be a highly muscular joint. You have the deltoid muscle on the top, you have the pectoralis major extending into the shoulder joint, then you have the trapezius muscle helping you up there, then you have the posterior fibers of the deltoid, you have the lats coming down. If we have to take out the trapezius, let's see if that's possible. Yeah, wonderful. So you can see the muscles underneath. You've got the rhomboides major, you've got the rhomboides minor, you've got the scalene muscles up there, you have the infraspinatus, which is a part of the rotator cuff of the shoulder joint. You can also now see the supraspinatus muscle, which is above the spine of the scapula. Right, so now we can also see if we can remove the deltoid muscle. Yeah, we can remove that. So now we can see a little bit more of how the supraspinatus comes at and inserts into the end of the tibial, end of the greater trochanter of the humerus. You can see the pectoralis minor coming from beneath. You can see the part of subscapularis, which is also the part of the rotator cuff muscle. You can see clearly the insertion of infraspinatus into the into the head of the humerus near the lesser tuberosity of the humerus. So this is how the shoulder anatomy collectively looks like. Alright. Right. So from that understanding, let's come over here and look at our athlete who tends to have slightly not exactly loose and lax shoulder, but he feels that around this part he feels, it's not as firm and as assuring as it should be. So this is the clavicle coming, this is the acromion coming, to somewhere is the acromioclavicular joint. And when we do rigid taping, this is the part we really want to stabilize, the acromioclavicular joint. Okay? Alright. So it is always good that the athlete, you see the athlete's range of motion. Okay, go full abduction first, right? Then go full adduction. Then you also want the athlete to show you the amount of external rotation he can do and the amount of internal rotation he can do. So all these movement assessment is important before you start applying rigid tape to stabilize the acromioclavicular joint. All right. So the first technique that we are going to learn is very simple. It's called as the McConnell's technique. In this case, what we do is we apply two strips like the letter T. So we start from the deltoid tuberosity here, and we go all the way up to the acromioclavicular joint. But there's a little trick here as we, so I'll just measure it up and I tear it off. So what I'm going to do is, so there's the clavicle coming and there's the acromion. So what is happening is this joint has got separated, which gives the athlete that sense of, not feeling as stable and as secure. So what we're going to do, we're trying to push this together. How do we do that? We will apply the tape, and as it passes through the acromioclavicular joint, we will push the joint. Maybe you want to come over slightly here. We will push the joint close to each other, and then we will apply the tape over the joint. So the tape has been applied while the joint was being approximated. So that's the first strip that goes into picture, and then the second strip is a simple crossover reinforcement of the first strip, so our acromioclavicular joint is right here in the center. All right, so that is how you apply the tape called as McConnell's technique. This is all right for mild looseness or feeling of, that mild degree of insecurity about this part of the shoulder. All right, so this is called as McConnell's technique.